Acute low back pain is what we're going to be talking about here. I'm going to give you some strategies on what you should be doing at home, keeping in mind that acute low back pain is the #1 phone call that I get as a chiropractor and that most chiropractors get. We want to give you some strategies. So I'm going to talk about, first of all, danger signs, things that you need to know in case you feel as though, do I need to go to an emergency room or does my family member or friend need to do that? We're going to talk about what's causing your pain, the ultimate source of the problem, so then you can get into solutions, how long it's going to take to get better, what you should be doing at home. The fifth thing being chiropractic, I'm going to talk about the chiropractic magic that we whip on people. And then, of course, 6, we're going to talk about prevention. Okay, first thing, let's talk about the danger signs. So you need to know that. Right after that, I'm going to talk about a couple of recent cases. So, danger signs. A few things that can cause low back pain, but it's not really low back pain. One would be kidney stones. Kidney stones are fairly common. They can cause sharp flank pain in the backside here. Now, kidney stones usually don't have radiating pain like a lot of low back pain does. It's usually right in here. Oftentimes, however, kidney stones will give you other symptoms that traditional low back pain doesn't give you. It can feel like you have a fever, sweats. It feels like you have an infection, you're fighting a cold. You might be vomiting, of course, difficulty in urination, blood in the urine, can't urinate at all. Okay, so those types of things. The pain from kidney stones often will come in waves, very, very sharp, eases off, very, very sharp. Of course, not relieved by anything. With traditional low back pain would be some position you're going to find some relief, and in rare circumstances you won't, but that's a little bit about kidney stones. So if you have any of those types of symptoms of kidney stone, that's an emergency room situation, particularly if you cannot urinate at all. I mean, you need to go right away, okay? Some other ones are changes in bowel or bladder function. Now, some of the symptoms I'm about to talk about is classified as cauda equina syndrome. The cauda equina is the base of your spinal cord. It's the fibers and the nerves deep inside the lower back spine. If some of that gets compressed, that's not a good situation, and you might have some of the situations of following. Problems with bowel or bladder function, inability to hold urine, like you don't have the muscles to hold urine any longer, okay, peeing your pants when everything was fine the day before kind of thing, okay. Saddle anesthesia, that's where you get numbness in the bottom part of your pelvis. Saddle, meaning if you were to sit on a horse saddle or a saddle of a bicycle, and that area that contacts there, if that is numb and you can't feel it, you need to go to the emergency room. Any of those symptoms, you need to definitely go. Weakness in the legs, weakness that you can't support your own weight. One leg that is particularly weak and getting weaker, progressively weaker quickly, like over the course of hours or a day or two. Foot drop is another one. Now, foot drop isn't necessarily an emergency situation, but if it came on quickly, you want to have that evaluated in an ER, and really great doctors and nurses, almost all of them are well versed on this, because again, it's not only the most common phone call to me, it's one of the most common calls to an emergency room, or one of the reasons that people go in for severe pain in that way. Severe pain just not being relieved by anything, by position, by medication, and so forth. I have even seen patients that have come in with this, and I have had to send them to an ER immediately. Okay. Now, as I said that, most of those danger signals are pretty rare. Most of the phone calls that I get are things that we can manage conservatively. But again, those emergency situations I just told you are emergencies. Go and get checked. Okay. Now, in a moment, I'm going to get into causes. Before I do that, I want to give you a couple of updates. Here we are in 2018. I told you about this woman that had started to come to me in January of 2018, 42-year-old female. She was having some backaches that were plaguing her over the course of a year, but she was still working out, lifting weights, and doing her thing. She really upped her weightlifting, and then all of a sudden in January got bad low back pain, numbness in the left leg, so severe, couldn't sleep. If you remember the story, she's lying on her back with her legs straight up the wall to try to get comfortable to sleep, couldn't sleep less than an hour a night, or would get into child's pose just to try to get a little relief, to try to get rested, right? So she's on her bed, sink back on her knees in child's pose, just to try to get some relief, okay? So here we are in June of 2018. I've seen her now 49 visits in my office, 49 visits. So we're 5 months in. She's now seeing me twice a week. She's back exercising. She started on the bike. Then she started getting into some light weights. Unfortunately, she overdid it a couple of weeks ago. We've backed off. She's backed off her weights. Now she's riding her bike. The numbness in the leg had resolved. It's come back a little bit, not all day long, but it's come back. She's still sleeping fine. So she's backed off and she's recovering from the little flare-up. Doing well, can do most of her activities of daily living. One of the good things is she's already modified how she does things, how she cleans the house, cooks, shops, bends over, picks things up, laundry, the whole deal. I've talked about that in other shows, and that'll be part of our prevention. One of the reasons I'm doing this show right now, a couple of reasons. One is a patient of mine in the past came in, 46-year-old female. In September of 2017, she picked up her running. Lower back was getting achy after runs. Went to her doctor. Doctor said, back off the running. She did that and then wanted to get back to it, so she started running again. In January of 2018, she starts getting some right leg pain, just in the morning, but it would go away for the rest of the day. Kept on going. Slipped and fell in April, made the pain a little bit worse. And then sure enough, unfortunately, 2 weeks ago, about a week and a half ago, 2 weeks ago now, lifting her son, putting her son into bed on a Sunday night, goes to bed herself, pain is terrible, can't sleep all night, driving pain down her right leg. The pain is worse in her leg, minimal in her lower back, pain is worse in her leg. Comes to see me a couple of days later, we're working on her, and there we go. So now I'm going to wrap this into causes. So what's causing your problem? What is causing your acute low back pain, sharp pain? Maybe it's just in your lower back. Maybe it's going into your rear end. Maybe it's radiating into a hip or two. Maybe it's down your leg or not. It can be down the side of your legs, the front of your legs. It can be into the groin. It can be into the knee. It can be the side of the lower leg, back in the calf. It can go to the foot. It can go to the toes. Any combination of what I just said can happen as well. So what is causing that? A lot of people say, I pulled a muscle. I've talked about this for 30 years now. In almost all cases, you didn't pull a muscle. Okay. Here's what muscle pain is. You and I go to the gym, we lift weights, we get sore. A day or two later, that's gone, not to come back. When you get soreness from a gym workout, you don't run to the doctor, you're not taking pain pills, you know exactly what you did, you're not alarmed, and there you go. Soreness post-workout has a particular sensation to it, right? You've all been there. Pain in the lower back that I'm describing right now is completely different. You know something more serious is going on, right? Okay. In almost every case, it's a disc problem. The discs are the cartilage pads in between the bones. Talked about them incessantly on this program, hundreds of videos on this. It's a disc problem. Now, from here on out, for the rest of this program, I'm going to tell you what I tell every patient that comes into my office with back pain, unless we're thinking something else. So here it goes. Here's the speech, okay? You have a disc problem. Now, when I say disc problem, I did not say disc herniation. I didn't say disc bulge, disc prolapse, sequestered disc. I didn't say that. I said disc problem, disc irritation. Now, in some cases, we can probably accurately diagnose a herniated disc by physical examination. If there's weakness in a leg, we do muscle strength tests. It's weak on one side, more power on the other. I do vibration on both sides, so I test your vibration. Weaker on one side, stronger on the other. You do reflexes. You tap the little hammer on the knee or the ankle. One side it's strong, one side it's weak. We do a little pinwheel where you feel little pin pricks. Again, it's dulled on one side and normal or appropriate on the other side. Maybe we do hot and cold tests as well, very similar situation. Duller on one side more than the other. In most cases, we can suspect that there is some sort of a more significant disc pathology, maybe a disc herniation. Okay? Backing up to the woman, the 42-year-old that I've been working on for 5 months, I diagnosed it correctly. We suspected an L5 posterolateral disc herniation left side. That was probably encroaching the L5 nerve root on the left. and lateral recess stenosis as it's called, and so forth. Sure enough, she had an MRI, paid cash for the MRI, and we saw a posterolateral left-sided disc herniation at L5. So physical exam can diagnose that. All right. Now, a lot of people, I would say the majority of people that have leg pain, leg numbness and tingling, do not have a herniated disc. They have a disc problem, a disc injury, a disc irritation, but not a disc herniation. And by the way, a slip disc doesn't really exist. It's just a word that people use. Discs don't slip out and they don't slip back in. That doesn't happen. Okay. Think of a disc like a jelly donut. If you squeeze the disc and it gets irritated long enough and breaks down, the jelly can squeeze off to the side. That's a disc bulge or a disc herniation. Okay. That can sometimes sit on a nerve root. Now, what's interesting, part of my talk to people, is researchers did a really creative article. They took 100 people off the street. These 100 people had no back pain, no history of back pain. They did MRIs on these 100 people. 50 of them had significant disc pathology seen on MRI. Osteoarthritis, wear and tear, bone spurs, disc herniations, disc bulges, disc wear and tear, thinning discs, and so on and so forth in 50 of the 100 people. No back pain. The problem shows first, the problem comes on first, the pain comes on last. Okay, that's what happens. Then I liken the disc to a tire on your car. Okay? Let's say you buy a brand new beautiful car, the front end's out of alignment, you don't realize it, nobody realizes it. You drive for 20,000 miles, the car's running silky smooth down the highway, nice and smooth, driving great, poof, the tire blows one day. Now you're on the side of the road, you're like, what happened? I had no idea, I had no symptoms moving along here. Somebody looks at the tire and said, oh, look at this, it's all worn down to the cords. Your front end was out of alignment, wearing down that tire slowly over time, unbeknownst to anyone, and the wear and tear was slow enough where it didn't give you any symptoms until it reached the breaking point, poof, the disc or the tire blows in this case. There we go. Very common scenario. The person that bends over to pick up a towel, I had a person who fed their cat recently, or whatever it was, and then gets the sharp low back pain and comes in crippled. It wasn't the towel or the cat food that did it in that case. It was the 100,000 times that we bent over and did that thing, like the slow wear and tear of the car tire, and it reached the breaking point. So think of the discs in your spine like tires on your car. If you keep the front end aligned, if you balance the tires, if you rotate them around the car, you keep the air pressures, in other words, you have this great maintenance technique, you're going to get equal wear and tear of the tires over time. You're going to get full life out of those tires. You're going to get 50,000 miles out of those tires, or in human years, you can get 130 years out of your discs in your lower back, you see? Because we know people have lived into their 120s and they're still ambulatory and functioning. Okay, so that's a little bit about that. It's the slow wear and tear. All right, then the next part of this is people want to know how long until I feel better. So I can give you an accurate range. The accurate range is anywhere from 1 day to 3 years. 1 day to 3 years, okay? How do I know this? Because I've had the one adjustment miracle where somebody comes in with terrible back pain, I'm thinking the worst, they're thinking the worst, this might be a while, it might take weeks, we're gonna have to do rehab and all this kind of stuff. I work on them once, they come back in the next day, back pain is gone. I wish it happened with everybody. And as I say to everyone that comes in, if I could take care of your problem in today's visit, I would do so. I would charge $1,000 for the visit, and the line to see me would be out the door and down the street, and everybody would come in and pay. Because everybody knew, hey, this is one-stop shopping here. I'm going to come in, get one treatment with Dr. Fuller, and I'm good to go, and there we are. Okay? It just doesn't happen like this, unfortunately. It doesn't happen anywhere. If the physical therapist could do it, the line would be out the door. The massage therapist, the acupuncturist, the medical physician, the nurse. Typically, that doesn't happen. Now, why do I say 3 years on the other side? So 3 years, if I could talk about my patient Gail, who wrote me a testimonial, it's on my website, talked about her in other shows. It took us from when we started to the point where she said, I love my lower back and I don't have a back problem anymore, 3 years. Now, most people are on a day, and absolutely most people are not 3 years. Most people are going to fall into a sprained ankle scenario. 4 weeks, 6 weeks, 3 months, depending on the severity, the acuteness, the sharpness, how bad the disc wear and tear and degeneration, how much wear and tear is on the tire, how good people are at following through, how good are people restricting their activities when they need to, doing their home exercises, making sure that they do ice, and so on and so forth, following the home recommendations. All of these play a role in how quickly somebody is going to get better. Okay? Now, the sprained ankle example goes a long way of explaining this. So when somebody comes in, I explain the lower back situation like a sprained ankle. Everybody seems to be able to wrap their head around a sprained ankle. You roll the ankle, you sprain it, it's injured, and you come hobbling in to myself or the therapist or whatever. Okay, so you come hobbling in. In that first day, you know that that sprained ankle is not going to get better today. You want it to get better today. I want it to get better today. The therapist does, and so forth. But we know the sprained ankle is not going to get better today. However, we're going to start the process of getting that ankle as good as it can be, as quickly as possible, and we'll slowly reintroduce the activities as appropriate. Now, as we talk about the home treatments of what I recommend on what you're going to do, think of a sprained ankle. So, first of all, are you going to be on your feet a lot with that sprained ankle? No way. You're going to listen to that sprained ankle. You're just going to kind of get through your day in the first few days, okay? Acute low back pain is the same thing. Second, you're not going to overstretch that ankle thinking, I'm going to stretch that ankle and get it better today. You wouldn't do that with a sprained ankle. Don't do it with an injured, sprained back, okay? If you overstretch that lower back in a desperate attempt, which I understand, to try to get that pain out of there as quickly as possible, you could do more damage, right? So you ease off. You ease off activity on the sprained ankle. You ease off the acutely sprained lower back. Treat it the same way. Next, should you use ice or heat on that sprained ankle? The ankle is swollen up like a balloon, hurting bad. What do you use? Always ice, never heat. Now, the same with the lower back. The body doesn't know the difference between a sprained ankle, an irritated back, a sunburn, a bee sting, or whatever. It's always inflammation. You always put ice on it. Now, the difference is some people try ice on their back, doesn't feel any better. In desperation, they try heat, bath, hot shower, hot tub, and so forth. Some people say, yes, but when I put heat on, I feel better. I want to keep doing that. Okay. The problem with heat is it might feel better when you put it on, but 2 hours later it swells up worse and the pain's even worse, so now you can't sleep. What I tell people is when they switch to ice, I call this my ice speech. When they switch to ice, ice does not feel as good when it's on, particularly in the winter. But a couple hours later, the swelling's actually gone down and you actually sleep better. So ice is a better choice, okay? Next is medication. Now, I'm a chiropractor. I cannot give any medication advice whatsoever. However, I can give you logic and I can quote information from research, okay? The research clearly indicates non-steroidal anti-inflammatory medications, which includes Advil, Aleve, aspirin, and so forth, and even some of the prescription medications. You have 48 to 72 hours to use those medications, basically 3 days. If you use those medications beyond 3 days, you're actually inhibiting and deterring the healing process. 3 days, okay? That's what the research says. I'm not telling you what to do, but that's what the research says. I think some people sometimes, occasionally, maybe sometimes, maybe use medications maybe a little bit more than 3 days, maybe kinda. But anyways, that's up to you, just letting you know what the research says, okay? The healing process is itself an inflammatory process, and if that is too much shut down, then the type of quality of heal of tissue will be interfered with. So that's what the research says, and we've known that for 30 years. Okay, that's what you do with that information. Now, people always ask me about medication. I always tell them that I can't give them advice, and there you go. It makes sense to me, logically, that if you're taking a medication and it's not helping at all, then you need to ask yourself the question, why take it? I find that a lot of people, not everyone, but a lot of people find that ice packs work just as good, if not better, than pain medications. The issue with that is you just have to sit for 20 minutes or lie down for 20 minutes with ice. So just kind of keep that in mind. Okay, so that's some of the home treatments that you can do. Now, sleep. Everybody asks me about sleep. When the back pain is bad, I'm having difficulty sleeping. There is no magical position for sleep. I just tell people this, just wherever is comfortable, okay? So some people find they can sleep on their stomach with their legs elevated. Some people need to be on their back with their legs really high up, boosted up with couch cushions and other pillows, okay? Some people need to be on their side with a pillow in between their knees. You might find that you can be in one position for a while and then you need to change. Some people, when the pain is really bad, actually do better on the floor. Some people do better on a couch. Some people do better on a recliner. It simply is experimentation. There is no good answer for everyone that's out there. When the pain cools off, then we can get a little bit more into sleeping positions, but it simply is just try to get into a position that is most comfortable for you. I just did a show recently on the decompression position, which is lying on the floor on your back with your legs up, bent at 90 degrees, or even your knees drawn closer to you, almost like you're curled up in a ball. So your legs are up on the back of a chair or a couch or whatever. So that's like a decompression position. Okay? Some people just need to get into that position to get some rest, or at least get through the day. I also tell people make sure you ice just before you get to bed so you can sleep a little bit better. One of the unsung heroes is what you're eating. If you're eating an anti-inflammatory diet, literally right when you're in the middle of an acute low back pain flare-up, you're going to have you have the chance of having less pain. An anti-inflammatory diet is basically eat real food, don't eat things that taste good. Eat things that don't taste good, right? So heavy on the vegetables, low on the sugar and so forth, and you all know that. Make sure that your water intake is appropriate, not too little, not too much, half your body weight in ounces per day. And there are anti-inflammatory supplements, and I talk about these in my office: omega-3 fish oil, B-complex antioxidants, magnesium, vitamin D helps some people, and probiotics and so forth. So there's a lot of anti-inflammatory things, digestive enzymes. Next, chiropractic. Now, the chiropractic magic is something that happens with so many people. I've had over 4,000 patients in my office here in Woburn, Massachusetts. A good chunk of them are from acute low back pain, and we've seen almost all of them get better. So the good message for you that is, if you do have acute low back pain, chances are very, very good that you're going to get better with conservative care, whether it be chiropractic and or physical therapy. You can do them together, and or acupuncture and or massage and or myofascial treatments and so forth. People will oftentimes do combinations. Some people will stick just with the chiropractic just because time is of the essence and cost and so forth. Okay. Now, oftentimes, like the woman I'm talking about right now, 49 visits, insurance doesn't cover that. Insurance was going to cover you maybe for 12 visits, but she says, I got to keep going because I got to get my life back. So she'll pay for that, but most people also find the cost of chiropractic is much lower than they thought. And for a lot of people, it's much lower than their co-payments are with their medical insurance. So the chiropractic really works, and we have a variety of tools that we work with. The vast majority of the patients that come into my office do not receive the manual adjustments which most people think of if they're not fluent in chiropractic. Manual adjustments are the cracking and popping of joints. Most people that come into my office do not receive that, particularly in the acute phase. It's just too painful to do that. I kid you not now, I had a 95-year-old man come in to see me today for the first time. Never seen a chiropractor before, never had acute low back pain. He has acute low back pain. I had him just sit on my table, and I did a couple of my very gentle chiropractic instruments just to get the ball rolling. And of course, I gave him everything that I said here with all the recommendations at home to get the ball rolling, and we might move to other things. With the chiropractic adjustments, we do instrument adjusting, drop table adjusting. I have an adjustment called the vibrocussor. You can look that up online if you want to. I have a low-level laser therapy, cold laser as it's called. I use flexion distraction, which is a type of table where you lie on your stomach and it gently pulls apart the discs to cause some disc decompression. It's not really a decompression table, but it's a flexion distraction table. It works on some people, doesn't work on everyone. I have a pulley, a very simple, very inexpensive pulley system that I use. I'll demonstrate that on a future show, which gives, again, some distraction into the lower back. I try that on some people. And of course, we give appropriate exercises when you're ready for it. And depending on your physical condition, we do those physical exercises. Okay, for most people, in a handful of weeks, you're going to get better. Most people, not all, but most people are going to get better in weeks. And then what do? The real magic is prevention. Regarding your teeth, the real deal is preventing root canals and implants and bridges and everything else that costs a whole heck of a lot of money and that's not fun to go through, right? How do we prevent that? we have an exercise program for our teeth that we have all accepted as completely normal and completely natural that we do for our entire lives. We've all signed up for it, right? We all know that this is important. I need to stretch my teeth 3 times a day. Brush, 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 maybe an electric toothbrush, maybe floss, whatever it is. And you know that you're going to be doing that, and you're going to have maintenance care at the dental office. You're going to have at least 2 cleanings a year, some people 3 or 4. You're going to be doing all these different things. And even with that, your teeth still need a lot of intervention. Now, we've accepted that with our teeth. I am trying to take that dental analogy and applying it to your spine. Take care of your spine every day. I find that when people have acute low back pain and they can't do anything, they can't work with their, they can't work out or exercise, they can't enjoy their life, they can't do the things with the kids, they can't clean around the house. They have the time and they have the money to come and see me. When the pain is gone, life shows back up, and then they don't have the time and money any longer. Okay? So what I'm telling you is, just be careful when that happens, because I've seen this happen a lot with people, is they're happy that their pain went away. I'm really thrilled as a clinician that they got better. Everybody's happy. They're able to get their life back and get back and do the things that they want to do. But then the motivation kind of falls off, and we're not doing the stretches. We're not paying attention to how we lift and bend, and I've done all those shows on the art of bending over and everything that I've done here. And dig into my YouTube page, by the way. I've got all these prevention techniques and strategies there. So we make sure that we stretch our spine just like we stretch our teeth every day. Exercise your spine, exercise your teeth. Start paying attention with sitting management, bending management, laundry management, grocery management, driving management, lifting up the kids management, cleaning, vacuuming, yard work, and so forth. Do all these things more appropriately. Start to think about it. Remember that you only get one spine. You can't get a spine replacement. You can get new teeth, but you can't get a new spine. You start doing that. I also tell people, spend that extra $20. Hire the high school football person to put the air conditioners in your window in the spring and take them out in the fall. Best $20 you've ever spent, and then just give that high school football player my business card, right? Because eventually they'll need me too. But make sure you do that. A person said, I like to thatch my lawn with aggressive raking, and then I busted myself up this spring. I said, pay the high school kid to go ahead and do that for you. Snow shoveling in the winter, pay the high school kid to do it, and so forth. The heavy lifting, have the big, strong people do that for you. Spend that extra $20. You'll be happy. They're happy to earn that money, that quick money, right? And that will do it. And the last piece of this is wellness and maintenance chiropractic care. Just like you go to your dentist, no problem, you don't complain, you go to your dentist. Just like your car is running fantastic, you go in for a tune-up, a checkup, an oil change, an alignment. You take care of those discs, you take care of the teeth, you take care of the house, take care of your spine and nervous system and body, and it will take really good care of you. I'm Dr. Scott Fuller. Join me again.